Imagine putting your mind through an eternal prison of self-deprecation and not feeling enough. You are having a long-term feeling of hopelessness and tearing yourself down. It's estimated almost half of the population suffers from depression at some stage throughout their life. Rather than joining that queue of mind prison, it's important to learn why we get down and how we can change it, because believe it or not, we create our own negative feelings, and we also ensure that we can turn our lives around and create a positive change for others. Everyone's lives are not perfect, but every single one of us matters. That is what makes us human. In the population of the United States, about 1 in 10 humans struggle with their self-image and their mental health, according to the National Institute of Mental Health. In recent generations, it is becoming more prevalent to worry about what one feels about themselves and why we should care for others that have rougher times in their lives than we do. Speaking from experience, I thought my depression was like a disease. It generated enough stigma, negative stigma specifically, which hurt my mental state more. For years, my parents did not think of anything from it. I also denied it from myself. I thought of myself as being broken and unfixable. And now I am an advocate to educate and dissipate the negative stigma that comes behind this kind of mental health. And to help you better understand, I'm going to explain the different types, symptoms, and treatments of depression. First, I will discuss the common types of depression. And there are multiple, that some affect both male and females, and some that are just uniquely to women. According to the NIMH, the 4 most common types of depression are major depression, persistent depression, bipolar disorder, and the seasonal affective disorder. And although women are at higher risk for general depression, they are also at risk for 2 additional diseases, which come through because of the reproductive hormones that we have, which are perinatal disorder and the PMDD disorder. Bipolar disorder is different from depression, but it is still included on the list because people that have low episodes are usually more mortal to depressive disorders. Postpartum depression is much more serious than the baby blues because many women experience them after giving birth. Lastly, PMDD is the premenstrual dysphoric disorder and is a type of depression that's a severe form for PMS, which happens either before menstruation or during menstruation. And next, I will discuss all the common signs and symptoms that all of these depressive disorders share. Knowing the risk and symptoms are important to especially help loved ones or friends that are also going through these types of stages so that you know that they may need professional help. So the American Psychiatric Association describes these factors as an agent or situation that is known to an individual that is susceptible to a negative condition change. For depression, the risk factors are biochemistry, genetics, personality, and environmental factors. Even though there may be several risks at play, there's usually a symptomatic trend of depression that is seen among the patients. In AMA studies of depression, these patients were experiencing symptoms such as persistent sadness, empty moods or feelings, hopelessness, and loss of interest in any of the activities they used to share. And finally, depression is actually one of the most treatable mental disorders. According to the World Health Organization, between 80 and 90% of people with depression eventually respond well to treatment, amongst all those patients that gain some relief from their symptoms. There are 3 types of treatment offered to patients with depression, which is medicinal, psychotherapy, and ECT. Antidepressants are medications that are given with patients that have depression. They may improve the way their brain uses the chemicals to control their emotions, stress, and anxiety. You may need to try several different medications until you find the right one that's for you. And the other types of psychotherapy or counseling, also known as, can help with depression. And examples of this include the behavioral therapy and interpersonal therapy and problem-solving therapy. And lastly, ECT, electroconvulsive therapy, is a medical treatment that has been used as a last resort for treatment for people that have severe depression. And it has major effects on the patients as well. So in review today, I discussed what depression is, how you can spot the signs and risks of depression, and how you can finally treat it. And if you get anything out of this today, then at least it's this. Please don't give up. You are worthy, and you are more than worthy. You deserve to experience this great life, and you owe it to the world to be that positive change for others, to inspire others who will look to you and will say that you did it, I did it, and we all did it together. Thank you.